In today's fast-paced world, people expect and appreciate timely responses to their questions. We found that several practices are using email and the internet to communicate with their patients for administrative issues as well as for clinical guidance, even moving towards the use of email in lieu of some office visits.
Recent polls indicate that people want to communicate with their doctors via email, and the patients we met confirmed this sentiment. Physicians found email efficient, effective, and manageable, and staff told us that patients are actually very appropriate in their use of email.
One of the big problems in primary care practice is always the phone tag. And we have looked on email as a way to allow patient after hours to get a hold of us. It's produced better access to me. I can sometimes, rather than call somebody back only to find out they're in a business meeting, I can send them an email. I'm using a web portal right now for email that provides secure access of them to me and me to them. It's secure messaging and password protected. I can also see whether they've actually read their email or opened their email.
If I have a question or need to get a prescription renewed, anything like that, I will send her an email early in the morning, and shortly after they open up, I will get a response.
I like communicating with him via email. It's easy for me. I have easy access. I sit in front of a computer all day, so I can easily upload information to him and send it.
I've used it to contact the office staff. Times I've had questions about a certain copay or just certain aspects about the health coverage, insurance itself, and it's kind of great. I just kind of send off a message, and at the end of the day or first thing the next morning, my answer is there, and I haven't disturbed the staff here, and I haven't been disturbed at home.
And we can keep an accurate printed record, which I think is important, so you can refer back to it if you have any questions.
But it saves visits in, phone calls back and forth, it saves the phone tag. It's just great. It saves a lot of time, and it gives you almost instant results, if you have to change something.
If I need to reschedule an appointment, or if I have a question about maybe something that's going on, some kind of a problem that I may be having or whatever, I'll send her a quick email, get my prescriptions renewed.
It's great that I can send him an email in the afternoon, and usually by the next day he tells me, move the insulin up, move it down. I have no instructions, so it's immediate. It's not a 3-4 day wait waiting for the doctor to phone call you.
It saves a phone call to the staff. We're able to broadcast vacations when the office is going to be closed. So it's a very good communication tool.
I think it's gathering steam now that family members are having other family members sign on. So I think every week we're adding between 5 and 10 new patients to the web service.
I think most of our patients use it to do appointment requests, refill requests, but I don't find that we're being bombarded with 23 emails a day from a single patient.
I will ask people that have a complicated problem to just schedule a visit. And I'll even provide an attachment that'll say, I need to see you within 2 weeks. They just click on it and provide what hours are going to be available in the next 2 weeks.
They can email him appointment requests, refill requests, if they're out of town, on vacation.
It's been pretty popular too. A few people use web visits in lieu of an office visit. They're charged up front for me providing a consultation on a common problem like headaches or urinary tract infection or back pain. I have to feel comfortable doing a web visit with them, but it allows me to make some recommendation, maybe do some research on their behalf, and get reimbursed for doing it.
We hear from ACP members who are reluctant to use email or the internet because of fear that it will lead to increased work for the office that is currently not reimbursable.
But we've just seen that patients respect the direct contact with the practices and use email and the internet appropriately, and that offices find that these communication tools actually improve the efficiency of the front desk.
And that from the clinical perspective, email and web visits provide timely access to care when non-face-to-face interactions are appropriate.